Good afternoon, and welcome to the October Council on Aging meeting. This meeting is now called to order. Commissioner Silverberg, will you lead us in the Pledge of Allegiance? Please turn your mics on, everyone.
Together, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Francine, will you call the roll?
Commissioner Borghi?
Here.
Commissioner Fotheringham?
Here.
Commissioner Grimm?
Present.
Commissioner Healy?
Here.
Commissioner Loomis?
Thank God.
Commissioner Norkin is absent. Commissioner Shentas?
Here.
Chair Searden?
Here.
And, I'm sorry, Vice Chair Shentas. And Commissioner Silverberg.
Yeah, he doesn't leave. All right, now is our time for public comments. Normally in public comments, we have anybody out in the audience fill out a sheet so we know who they are and what they wish to say. Apparently no one's done that, but is there anyone who wishes to make a public statement at this time? Okay, we will move on to our program, our guest speakers, and I'll turn the program over to Commissioner Fotheringham. Nick?
All right. Our program today is on health care and wellness for seniors, and we have a panel that's going to be moderated by Betty Berry. I'll let her introduce the panelists, but I wanted to say a few words about Betty first because I have it on good authority that there are 3 people in our television audience that don't know Betty. Most of us have had some personal contact with her. Betty is a senior advocate with Senior Concerns, and she advocates for seniors not only one-on-one, but she has a regular newspaper column in the Ventura County Star that appears on Mondays. Wednesday now?
Wednesday, yeah, they moved us.
Oh, sorry. Wednesday.
But you can buy the paper on Monday, too.
I do. So, Betty, I'll let you start from there.
Thank you. And it's good to be back. I haven't been here in a while. Good afternoon to all, and welcome to this Council on Aging's panel presentation on senior health and wellness issues and concerns. As we age, it's important that we continue to educate ourselves on the things that are important to us, and certainly health and wellness is on the top of that list. As an advocate for seniors, I find the most important part of my work is really education. It doesn't matter what the subject. If it's important to a senior, then education on that subject is what we do. Today, there's much discussion on health, wellness, issues, and concerns. So some things are changing and some are not. We need to take time to understand these issues. The only way to do this is to become educated. And that can be done at home by reading, coming in to see us for counseling, or attending a presentation as the one you're attending today. This responsibility, however, cannot be delegated. Just because we reach age 65 doesn't mean that somebody's going to stand up and say, "You're no longer responsible. I will just take care of you." Maybe we'd like that to happen, but I got news for you. It isn't going to happen. Our panel today is made up of 3 professionals who deal with senior health issues and concerns, however, each in a different venue. I only have 2 panelists here at this time. The missing panelist, who will arrive, I hope, is Diane Duff from Los Robles Hospital, where she is the Director of Infection Protection. Catherine Raley from Ventura County Area Agency on Aging, where she is the manager of the Health Insurance Counseling and Advocacy Program, better known as HICAP. And Carol Freeman, president of Senior Concerns, a nonprofit organization here in Thousand Oaks. Each panelist will be asked 3 questions related to their field of expertise. As our time is limited, and since we had no questions, it's not quite as limited as it was, I'm asking that you hold your questions to the end so that we can have each panelist do their part. So without me doing any more talking, I'm going to skip to our second panelist, who will be Catherine Raley, and I'm going to start with her questions. Kathy? First question. There has been much talk about the economy in California and the need to cut services in order to balance the state budget. Would you please explain how these cuts have affected local health services for seniors here in Ventura County?
Thank you for the question, Betty, and thank you for allowing our agency to be here today, and to the Council on Aging. I'm going to tell you the cuts that you already feel here locally with the state budget. The property tax referral program has been eliminated. The Renters and Homeowners Assistance Program has been eliminated. Linkages program, which is a part of in-home support services, has been eliminated. The respite program through our agency where we grant out has been eliminated. Brown bag has been eliminated. However, you will still see some brown bags around because like Food Share and a few of the cities and different things are taking up the money that isn't coming from the state. There is significant, huge cuts in Medi-Cal. The Medicare, MSSP, the Multi-Specialty Services Program, which is in our agency for in-home support, has been significantly cut. Long-term care ombudsman is still here in our county, but with very limited funding. In a lot of other counties throughout the state, there is no long-term care ombudsman. And then our in-home support services for our frail that it helps them stay in home and not go into nursing home and live independently is probably about more than 2/3 cut. Maybe there's some saying 90%, so it's going to be the most of the frail are going to be there, but everybody else is going to be terminated. That is a huge, huge problem in our county. Where are all these people getting services? What are they doing? Are they living by themselves? Maybe laying on a floor right now where they can't even get to a phone, has no lifeline. There's many implications of the cuts in the state budget. However, I want you to be really aware that this year's state budget is not balanced as of today. So there could be more cuts come in mid-year. So even though we know what the cuts are, there could be more because we do not have a balanced budget for this year.
Okay, that's the good news. Question 2. Medicare and Medi-Cal are the primary health care coverage programs for most seniors. With all the talk about health care reform, both state and national, will you explain how these reforms that are being proposed or already made will or will not affect our programs?
Let's take our state first,
okay,
and we'll talk about Medi-Cal, Betty.
Sure.
With these cuts on Medi-Cal, if you have a little bit over than what you're supposed to have for Medi-Cal with no share of cost, you would still have your Medicare Part B premium paid, which is $96.40 a month. But with this new budget cut, it has produced a yo-yo. And what it's doing, it's cutting them off at $500 of share of cost. So if they do reach their share of cost, which you could look at as a deductible, then the next month, if they take it into Medi-Cal and have it put through the system, they would be on Medi-Cal with no share of cost. So it's a yo-yo. 1 month they may be, 1 month they may not be, and it is a lot of bookkeeping, trying to find receipts and keeping things so that you will be able to get on no share of cost. So that has really been cut. There was a lot of the fees in Medi-Cal have been cut somewhat. So there's a lot of problems with that hearing. There is no more hearing for your hearing aid. There is no more dental, and there is no more podiatry. And I'm missing one. What was it? There's one other that I'm missing.
Vision?
Vision. And I cannot tell you how many calls we're getting a week on just those things because they really needed service. And it's for the low-income population, this is huge. Where do they go? What do they do? So we've been trying to put some type of assistance programs that we know of so that they can reach out and different things, but the cuts are very, very significant. And these same Medi-Cal cuts are the ones that are in your in-home support services, because that's under the Medi-Cal, and that is just huge. And isn't it funny how seniors and children are always the one that take the most cuts? It's never the healthy individuals, it's the frail and the young.
Well,
Now,
if they keep up the cuts, we'll all be frail.
yeah, we. Okay, then on the national, I will only speak on the Medicare portion of it. As it stands today, it is good, because it's going to afford a lot of the money coming from the Medicare Advantage programs to fund the prosecution and investigations of Medicare fraud. Now, I know there's a lot of people that think, well, they should be doing a better job, but this is also in the marketing of all these Medicare Advantage plans. This is in durable medical equipment fraud, and you have no idea, but it's in probably the billions of dollars of fraud that is out there. And we have it in our county. Every week we come across fraud cases that we have to report or we have to investigate. And the big one, and it's still going on, is the scooter, sort of, where a van comes to the frail and to health daycare centers or daycare centers, and they get these people to go to Los Angeles, and they take their Medicare and they take their Medi-Cal, and then they're billing for services because they never get the bill. They're just billing for the money, and they never get the product. And it's huge. It's huge. About 9 years ago, there was a OIG, Office of Inspector General, done in Los Angeles, and they set up a clinic to catch the perpetrators, and they did, and it was the Russian mafia. And they found that all of the money was going to a Russia bank. And thank goodness it was a bank that we could get the money back out of, and it was over $17 million, just that one entity of doing the type of fraud I am. But let's take a look at Medicare brokers, agent brokers. What do they do to you? They come to your house and they say, oh, I just want to go over your plan. Social Security told me to come and see you. So you let them in. And so then they come in and they talk to you, and yeah, you look like you have a really good plan, but will you sign right here so that I can show my boss that I was here? Well, you just actually put yourself in another plan and don't even know it. And that goes on all the time, and not just in our county, across the United States. And you have no idea how ships, that is HICAP and other states, have to do to fight this fraud. So this is where this money's going. It's also going to give universities money to have individuals become primary care physicians, because we know with baby boomers and our seniors living longer that we do not have enough primary care. So this is another good funding. I know there's some bad sides that you might think, but I think as it stands, it's good. And I want to tell you one other thing that's on the Senate side, and I know I probably won't say his name right, but Senator Baucus, I think it is, he has in that amendment for the annual election period, that is your open enrollment, okay, to be changed from October 1st to November 15th. Oh, no, this is good. The reason is because then from November 15th to January 1st, all of these plans have the time to sort out, get your cards to you and everything. It's going to be, if it goes, it's going to be a much nicer process, less confusion, less marketing fraud, because it's going to take the open enrollment period from January through March 31st, where the Medicare Advantages have been going, and that's where we see most of the fraud is during that period, it will go away. It also is going to give your seniors the time to spend the holidays with their family and friends, and also everyone else involved, including us. So we are really looking forward to that change, if nothing else, and we do hope that passes, because we see a lot of advantages to it and no disadvantages.
Kathy, can you speak, you mentioned fraud. I would like you to speak to two things, and these are not questions I gave you before. But I am very disillusioned every time I turn on television and see these ads for scooters. Are these legit?
Okay, I'll tell them the best way I know.
Okay.
Maybe, maybe not. Okay. They're not doing anything that's illegal. They haven't crossed the line, okay? And I'm seeing that even in our county with some of the plans doing their marketing. They're doing it so they're really almost right there that it is illegal, but not quite. So if they don't really identify all that much, then they have the right to say that. But if they really identified how they were doing it and it was really out there, they could be. So it's a real gray area.
Okay.
Don't ever trust. Don't trust. If you want to go that way, you say you want time to think about it, bring it into a HICAP appointment, let us look at it, and let us make some calls and make sure that they've done their homework and that you're okay with it. Because I have a case right now that they've held a chair for a scooter for 9 months. And he has not had a scooter to use. And I don't know for sure because I've looked at the case, but there's a lot of gray. And this individual has some mental disabilities, so he can't advocate for himself. And I don't know if they're kind of using that or not, but we need to be looking more at that. So be very careful when it comes to the scooters and the wheelchairs.
Okay, another, maybe a statement, not a question, but I do cover this a lot in counseling. But I don't think seniors really realize how important that Medicare Summary statement is, and that they are the grassroots, and they are the ones that can stop some fraud. So could you address that for me?
Sure. Well, now you as an individual, if you're on Medicare, you do not get a Medicare Summary for every visit. They're done quarterly. But you can go on mymedicare.gov and you can sign up and you can go and look at that. You can order your Medicare Summary notices, and it's a really nice thing that all of you need to do. If you don't know how, you can come to HICAP and we can show you how. But it's a very nice tool in the Medicare website. And to go to the website, it's just www.medicare.gov. And then you're going to scroll down. It's on the left-hand side. You get a password and everything. But you need to look at your Medicare Summary notices, because how do you know who's billing for what? It's not, I just had one the other day that they never were at that place. They were never at that doctor or nothing. Now, not saying that it was the doctor. It could be just a mishap, but you need to look, because if there's charges on there that are not correct, you need to get that certain thing corrected. Also, they may be telling you you don't owe a thing, and yet your provider may be billing you and hounding you for payment, or maybe not the correct payment. So you really need to look at that, and especially in January of every year when your Medicare deductible is. Let's say you go to your primary care doctor and the doctor sends you for x-ray and for lab. Well, you pay the doctor because you're a good person and you know you have that deductible. Don't do that. You wait until your Medicare Summary notice comes in for all of them, because if the x-ray doctor did the billing first, that's where you're going to pay your deductible. So it's all in who sends the billing in first and different things, and your Medicare Summary notice will advise you of that. So don't be so handy to get that checkbook out right away.
That's happened in the advocate's office also. We had a lady who, January, went to the doctor. She went to several doctors. One of the doctors said, or billing people said to her, this is your deductible, give us a check now. This is when the deductible was $100 a year. She wrote a check for $100, but when we got her in her Medicare statement, that $100 was for another doctor, and so now this doctor was reimbursed by Medicare as well as the check from the lady. To get that check back took us 9 months. So let them wait for their money.
Exactly, and that's what Medicare advises all of us advocates to tell you, is wait, don't pay. And if they're Medicare assigned, they know they have to wait. That's the law.
You wait for your Medicare summary, and you also wait for your supplemental summary to see what the supplemental company may or may not have paid.
Because if you do have a Medigap, you may have that covered, so your Medigap would cover it, so you don't need to write a check either. But you may forget that you have that in your Medigap insurance.
We have a problem with people disenrolling when they should not, and end up with no coverage at all for the rest of the year. Can you explain? I know you can. Will you explain how that happens?
Well, they're confused because for years now, you could change month to month. As of the Medicare Act of 2006, the Modernization Act, you're in lock-in now with Medicare Part D or all plans. So whatever you take during open enrollment on January 1st, you're locked in for the whole year. And if you drop out, you're dropping out of that whole plan. If it's a Medicare Advantage, you're not only dropping out of your health insurance, but on your Part D also. So then you have no prescription coverage. And you know, I don't know how many seniors, Betty and I and all the rest of us, said, well, I was mad and I just dropped out and I can't get my prescriptions now or whatever. And you know, sometimes we can get you back on, and a lot of times is maybe we might have to deem you for low-income subsidy to do it. But if you're not low-income subsidy, we can't do that. And then we have to look for to see what prescriptions we can get for you through Needy Meds or patient assistance programs. Do yourself a favor. Go ahead and vent at the refrigerator at your friend or something. Come to HICAP. Let us see what's going on and see what your rights are before you do anything. Because usually we can fix the wrongs of if you've been wronged, so you think.
We'd really like you to come to us first with your question. Then we can advise you and do it right. But unfortunately, most of you come to us after you've done something, and then we have to put out the fire. And it's not an easy thing to do.
I'll give you a quick example, if I may. I had a client last week or 2 weeks ago now that someone told her to take a Medicare Advantage plan because it covered everything. Well, she came down with cancer. She has an $8,000 bill for radiation because she trusted a friend, and you trust your friends or your family, but they don't know all the ins and outs. And I'm trying to get all of this maybe retroed back to Medi-Cal and different things so that she won't have to, because she's on very low income. But I don't know if I'm going to be able to help her. I'm going to have to probably go to the radiation center and see if we can get some help there and everything. So really, really think about it before you make moves, because you don't know where you may end up at. And this person thought she was doing the right thing.
And that's the trouble. You talk to your neighbor, and your neighbor will suggest something. It might be right for your neighbor, but it's not right for you. I want to add one thing about fraud and salesmen. Some of you may live in a gated community. Don't feel too secure. We have had, in the last month, I have had one occur at Leisure World in Camarillo and one at University Village here in Thousand Oaks, where the salesman managed to get through the front gate, and then he had freewheeled of the whole facility, and he was ringing doorbells and so forth. So if you are in a gated community, be just as careful as if you weren't in a gated community. Okay, question number 3 for you. We're going to overwork you here because we're missing a person. Every year there's open enrollment period from November 15th to December 31st that you just mentioned, when seniors can make changes in their health care coverage for the coming year. Presentations are usually scheduled to assist seniors with making those decisions, and I know we have some planned. We're doing a lot of extra ones this year, so if you could go through what those might be and what they might cover, and then I think I have the dates for Thousand Oaks.
Okay, I'll let you take care of the dates. Well, this year, the MIPA Act of 2008, now you're wondering what MIPA is, and let's see if I can remember. Medicare Improvement Patient and Providers Act of 2008. That's all the new regulations and rules for Medicare. So the MIPA is really in place for low-income subsidy, or as known as Medicare Savings Program, which would be your qualified Medicare beneficiary, your SLIM-B, and that's specified Medicare beneficiary, or Q1, that's just qualified individual. And then they have the QWD1, and that's the qualified if you're on Medi-Cal, and if you're disabled and you have a very small job, you could qualify that, and you may have a premium to pay each month, but you get Medi-Cal in full. So you would have Medicare Primary, Medi-Cal Full, and you would be on your LIS, low income subsidy, for Medicare Part D prescription drugs with no premium, no deductible, and no donut hole, and you would also receive your medications 1 and 3 or 2 and 6 wherever you may fall. So that program has been, it really changed for January of 2010. If you qualify for that program now, you can have assets up to $4,000 for single, $6,000 for couples, but your income would be more in the Medi-Cal range, very low, under the 150%. So what Medicare, Center of Medicare and Medicaid Services, and the Department of Health Services have found is there's a lot of seniors out here in the United States that are in this group. And so they changed this program in the asset level. So for singles, it will go up almost to $13,000 in liquid savings. And for couples, it will go up almost to $18,000 for $17,000. So you don't have to spend that money. You can keep it, but yet you will get low-income subsidy for Part D. If you're qualified Medicare beneficiary, you would get your Medicare Part B paid for, and all your co-pays and deductibles on the health side, and also your Part D. If you were the SLIM-B, as we call it, you're going to get your Part B premium paid. And if you're Q1, you're going to get the Part B premium paid. And if we can get you on the disabled, and you can be on Medicare over 65 for the disabled program. Now, a lot of people think that you have to be under 65, and that is not true. Then we can help you in that. So we are not only doing the presentations for that now, but we're doing application workshops that we will go out and help you fill out the applications and get them into Medi-Cal or the LIS ones into Social Security so that you could be qualified before January, and so that you can take advantage of the prescription drugs and the benefits starting January. So that's what that's all about, and you may not be surprised, but I will be surprised at how many we come up with, because I know there is a lot of pockets out there in this. And we are really going all over the county and really concentrating into this population. And so if you think you might qualify, just call HICAP at our office, 1-800-434-0222, and we will get you to the appropriate office within your, wherever you live, and help you. And then in November, we will start with our open enrollment of all the plan changes for 2010. That would be on Medicare side, your Medicare Advantage changes, the Medicare Part D changes, and they are going to be immensely changed. I'm right now in the process of changing all the Part D prescription drug plan changes, and there's a lot of extra work this year, and we're going to have to do a lot of extra presentations and explaining it to you, because it's not going to be, it's easy if you want, but if you really want to do the best, you really got to do more. And a lot of these prescription plans are now going to go into another plan, and they're not really telling you that. They're just saying, they're giving it to you, but the way the letters wrote, I had to even call them today to figure it out. You're getting letters right now. Put them all in a bag and bring them to one of our workshops or to the HICAP counseling. I mean, it's that intense.
Some of the counseling is going to be on Part D, and I'd like you to explain how we're going to do it this year, that you're going to do all the computer work in Ventura.
Well, it's not just me. We actually do have volunteers that are going to be working in our office in Ventura. And when we go out, we give you a Part D worksheet to fill out, and you can either mail it or fax it in to us. We will have our trained staff and our trained volunteers to do the comparison. We will do 3, and then we have already set up different boxes of where we're going to be to come out and explain them to you on what days. And we would call you and say, can you come on this day? If you can't, we'll find a day. If not, well, then we will send it to you and we'll explain it to you on the phone. So that's what we will be doing, so there won't be sitting and waiting a long time. We will already have them done and just be going over the counseling of the comparisons for you. And that will not only just be on Part D, but we can do it on, if you're on a Medicare Advantage, because if you're on a Medicare Advantage, you can't be loyal to that company, because it's your Part D prescriptions that may decide that you need to go on another one rather than stay, because you would be surprised that I've seen a lot of them that none of them even cover the drugs that someone may be on. So they need to make that change. So Part D is a very important part of the aspect of what we do, but it's not the only one. So I'll do all the comparisons for you and what have you. Now, what if I just walked in? If you just walk in, we will take you, but we would prefer to have it done by an appointment. And we'll be doing this maybe 2 times out here in November and December. And if we have to, we'll do it a 3rd time. I'm sure we can accommodate and get the room available if we need to be out here more.
The biggest complaint we have about Part D is that thing called the donut hole.
The donut hole.
Is that going to improve any, or do we not know?
Well, to date, what I've seen, I saw one plan that has generics covered in the donut hole. Okay. I heard that there might be a few. I don't know if California will have them for sure, because I haven't looked at all the plans yet. I do know that in 2011, there will be donut coverage starting, where you will get your brands and what have you.
Really?
Yes, but that's down the road. That doesn't help us today or next year. So we also do something that you may not know of, and I have to say the names because that is where it's at. But when we're looking and we see that you're going to be in the donut hole, say in April, and there's nothing else out there for you, then we get and we look at all your generics, and we get the Walmart and the Target, and that's the only 2 that are out there right now, and we say, look, you can get this one, and this one through the $4 plan for 30 days, or $10 will buy a 90-day supply. So if you can use your generics in that way, you're saving the money on your Part D plan for those brand medications. So we do explain that to you when we do go out, and we started this last year, and we will be doing more of that, because your deductible this year for 2010 will be $310. Ooh. And you will cap out for the donut hole will start at $28.30, I think it was what I've been seeing. Now, a few of the plans are going to have it a little bit different than that, a little bit higher for you. But I can also tell you that the premiums have really gone up. So, it's going to be A little bit harder probably for a lot of us that are on Part D and do not qualify for low-income subsidy.
The most important part of that printout that you do, and they do an excellent job, but the most important part is on the last page where we have a little bar chart that you can easily understand, and it has the 12 months of the year across there, and it shows you exactly how much you will pay each month, including your premium, and you can see exactly when you fall into that donut hole.
And that's what we look at, because when we see that, we know, and then what are you going to do when you're in the donut hole? However, if you do get in the donut hole, we can put you on patient assistance plans if you have the income range. So don't just give up and start buying those, because if you aren't ever really going to get out of the donut hole and spend $4,550 to get out of it, get on the patient assistance, because usually they last for 1.5 years, and you're going to get your medication for whatever it is for like $10 or $15.
We don't probably have any about-to-be 65ers in the audience, but we probably do on television. I would like you to stress the penalty if you don't enroll on time.
The penalty is 12% per year for Medicare Part D. Now, we're in our 5th year of Medicare Part D, and I can tell you this year alone, the penalties were pretty significant, over $20. And even if you're on low-income subsidy, you have to pay that penalty. So, don't dismiss it. I'm very healthy. I don't need it. You never know when a catastrophic illness may hit you. So what we kind of recommend is try to find the cheapest plan and buy the cheapest plan. That way, if you do have a catastrophic, you're covered, and also you're not going to get penalized. Now, I know, well, why should I have to do that? Well, Part B is the same way, only it's a 10% penalty. So, that is just the way insurances work. You have to use the good to the bad to get everybody covered, is really what it amounts to. And more often than not, we see people that don't do it, and then they have a heart attack, or they come down with cancer, or whatever it may be, and they come back and they say, I need to get it on. And a lot of times we can't get them on because they don't qualify, because they're in lock-in, and they have to wait until the open enrollment to get their changes.
As far as appointments or seminars in Thousand Oaks, we have a very, very busy senior center. Trying to get a room for a seminar is a little difficult. We seem to get Friday afternoon. Starting on the 30th of October, it looks like every Friday, one of us will be there doing one kind of seminar or the other. In the next week or so, these will be in my column in the paper telling you which ones are which. I don't think you can attend too many. Even if you are not low-income senior now, you may be at some time. I think you can learn from these. So if we have to be there, we hope that you're there too.
And we will also be running ads in the Ventura County Star I think we're going to be running them every other week, and it lists all the presentations and one-stops that we're doing for that 2-week period. So, probably it will be on the Monday cycle. That's, I think, what we had last year, and I'm going for the same this year. So you can always catch it in the Ventura County Star, or call us 1-800-434-0222, and we'd be glad to send you to the nearest one or answer any questions. I'd like to just say one other thing.
Sure.
HICAP won a grant back in May, and it was for technology. And I don't know how I did it, but we did. And it is for a website. So November 1st, we should be out there on the website, and it's called The Road to Medicare and Long-Term Care. And it's a different type of website. It's very easy-friendly, but it'll have everything for 40 to 64, employer group, 65 and up, long-term care, caregiving. It'll have a place for presentations. You can email us or do anything like that. We're supposed to get Twitter or Facebook, but We will get there on that. But yeah, I'm really excited about it. And your volunteers did this. This was a collaboration of the volunteers for Ventura County, and your Thousand Oaks volunteers worked really hard on it. So Road to Medicare and long-term care, look for it in around 1st of November.
Very good. I have seen the pre-runner of this, and it's really very clever the way they have put it together. If you need information and you don't have it on these seminars, you can call the Advocate's Office, 495-6250. We'll make sure that whoever's in the office will have a schedule and can tell you when they're going to take place. Also, I am currently collecting input. I do have the forms that you can fill out with your Medicare, your medicine information, and I am collecting them, and I will send them up to Kathy as soon as possible, but I understand you can't run them until November 15th.
Well, we can run them around November 1st.
Okay.
The website is still shaky at that point, and plans are still changing some of their medicines. So I don't like to really start running them until a little bit into November, but definitely around the 1st of November is when we start running them.
So Kathy will get them and then can make arrangements for you to come to a meeting and be counseled on it. Or if it's somebody who wants to come in for private counseling, we can do that also. I just have to say about Medicare and its programs is when you're not 65, when you're younger than 65, your employer has a health plan, and they say, do you want it, take it, or leave it, and that's the decision you make. When you turn 65 and you get maybe a little confused like some of us are, you have all these decisions to make and you need help to make them. There's no question about it. I will come back to you with some questions that I had for speaker number 1, who's not here yet, but we're going to go on to Carol. Carol, the first question is, many senior services are provided by nonprofit organizations. I'm sure you know that. These organizations can be large or small and offer a variety of services that seniors need to maintain a healthy lifestyle. Your organization served the Conejo Valley since 1975 and provides a variety of programs. Would you tell us what Senior Concerns offers to the community and how that impacts the health of the seniors and their families?
I'll sure try, Betty. Thank you. And thanks also to the Council on Aging for allowing us to give this information. The one thing we hate to hear, whether it's Betty or Tony or some of us at Senior Concerns, is when someone finally makes it to us and gets the help they've needed, we frequently hear, why didn't I know about you a year ago, 6 months ago, 3 months ago, whatever. So for all of those people listening on television and watching on television, go tell your neighbors. For all of you sitting here, tell 10 of your neighbors. There's a lot of help out there, and yes, Senior Concerns is one of the places you can get them. We really serve as an umbrella organization, providing resources and information on many, many, many other places, including HICAT. I learn something new every time I talk to Catherine, and the alphabet soup alone that she can spew forth with is pretty amazing, isn't it? Senior Concerns, as Betty said, 34 years. I work for Betty now.
Oh, yeah.
We started 34 years ago with one program called Meals on Wheels for the city of Thousand Oaks, and we continue that program today. It's one hot meal, one cold meal delivered to around 80 or 90 homes every single day of the year except Christmas. And for Christmas, we make sure the person is going to have food, either from neighbors, families, or whatever else, or we deliver extra food the day before and check on them the next day. How does it impact health? I guess the best way I can tell is one story. There is a lady who finally had been in the hospital a number of times in the past year, was referred to Meals on Wheels when she was discharged, and started getting Meals on Wheels. She was somewhat capable of cooking, not as able to get out to grocery stores to maybe buy all the right foods at the right time, but she lived alone and wasn't real interested in cooking, even if she could cook. It wasn't always fun to cook for yourself, so she didn't, which put her diabetes into such a state that she was admitted multiple times. She's been on Meals on Wheels 6 months, has not been back in the hospital. How does that impact health care? One day in the hospital could pay for a whole year of meals for this person. Fees are charged, but they're on sliding scale for all programs at Senior Concerns. So that's one way, Meals on Wheels. Second program is the Adult Day program. Now, many of you know this, if you're listening out there, as the Fitzgerald House. That's how we started. It was a small house down on Hillcrest, and when they widened the street, we had the opportunity to go on moving on up the road a little bit. The Adult Day program is a program that is for frail and special needs seniors. Now, that sounds like they're all developmentally challenged or something, but they're not. Predominantly, it's dementia, Alzheimer's, but it might be a stroke. It might be Parkinson's. It might be I'm 102 and I'm just frail. Ages range from around 60 up to, right now the 102-year-old is not attending, but a gentleman will be turned 100 tomorrow, and we're going to play bagpipes and celebrate his birthday tomorrow. Average age is 83. What does it do for people? It's a kick. If you want to come down to my center during the day, I have the best place to work. We dance, we sing, they knit, they exercise, you name it, there's activity going on there all day long. But the most important thing that program does is what it does for the families. If you are a caregiver responsible for somebody that can no longer fully take care of themselves, you need a break. Some people are still working. I was a daughter caregiver for a while. I worked. I had to find someone who was there during the day. I didn't have the day program where my father-in-law lived. Here, we're open from 7:30 to 5:30. Caregivers can drop them off at 7:30 in the morning, pick them up 5:30 at night. The people are happy. They're tired. They're going to go home and sleep. Gives the family 2 chances to rest and or work. The other program that we run, so day program is a matter of socialization and fun, even if you don't really need that time away, but it is a respite time for families. There's a well-known fact that the caregiver is probably going to be sick and or die before the person they're taking care of. Another program we have is, that we started a couple years ago is care management. However, before care management, we had what we call the advocates, the Betty Berries, the Tony Hagopians, who are in various places around our county and certainly our city, providing information and referral resources. They might solve your problem. They might just direct you to where to go get it solved. So it's a variety of things they do. We see 8,000 or receive phone calls, one or the other, from about 8,000 contacts a year in that program alone. Throughout the county, we do operate beyond Thousand Oaks. The care coordinators can serve a role coming in to help families figure out maybe those very complex issues, anything from I'm a senior. One recently, I'm a senior. My son and daughter-in-law were evicted from their home, and now I have no place to live. There are, sad to think about it, homeless seniors in Thousand Oaks. I don't like to think about it. It might be Medicare or Medi-Cal, as you have heard here this morning. Betty and Catherine are frequent referrals that we make. It might be a variety of things. You know, I just don't even know where to go to sign up for Medicare, something so simple as that. So in addition to those programs, we do support groups. Again, this is just helping the people who are trying to provide care. Sometimes it's easier to deal with what you're dealing with if you just know you're not alone in that little pot out there, that there is somebody out there who is going through the same kinds of things and learning from them, or learning from our group leaders who have seen and done it all. At least we think they have. We have something that not so many folks hear about, and that's our Alzheimer's Resource Center. We are the Alzheimer's Resource Center for the entire county, and this means we do public education, we have the day program, we have the support groups, and we will do one-on-one counseling when it relates to Alzheimer's diagnosis specifically. So it's a resource that has been around for a number of years now. The unfortunate part of it, I thought I had a really upbeat message, unlike some of Catherine's, but The unfortunate part of it is that program, our Alzheimer's Resource Center, was hit by the state budget, and the funding for that program was eliminated. Our board of directors, a volunteer group of people who come in and help us make decisions for the center, made a very solid decision that they will not give up providing those services. So we will make that up. We will figure out how to do it. So those public education programs will continue. The resource people who can help you get information on Alzheimer's will continue. We may refer a little more out. And a major part of it went into that day program, and the commitment from the board and from our organization is that it will stay. While I speak of public education, I'm going to leave behind a couple flyers. We have our series starting next Tuesday. The first one, we're going to do a little, the series this year is going to be on growing old and staying young. Now, as soon as Betty has figured that out, the rest of us may need to come to some of the classes. But the first one is going to be on successful aging. There's a Dr. James Beeran that we are fortunate enough to have living right here in our community, who is one of the founders of the whole gerontologic kind of field of study. So he will be speaking that evening, Dr. James Beeran, and that should be a fun one, and that is next Tuesday, the 13th. So mark your calendars, give us a call. We just like to know the numbers of people attending, so call the center, 497-0189. There's another program not so many people know about. That's called FAST. F-A-S-T stands for Financial Abuse Specialist Team. This is a group of professionals that come together. They are from throughout the county again. We coordinate that team. Financial abuse of seniors is a very significant issue. And sadly, many times, most of the time, that abuse is from family members and close friends. This group of professionals come together once a month. They may do case presentations. Their purpose is one of educating, so we have a DVD, if you would like one, on the types of financial abuse most common, everything from scam sales to telephone calls to your own family. But it is posted on our website, and it is available if you want the DVD itself. The group come together to discuss cases, provide that education, and also just kind of to educate each other. The types of people in there: adult protective services, every law enforcement agency, the prosecuting attorneys, the district attorneys, the public defenders, banks. They all come together and they learn from each other so that they can just be more effective in their own jobs in addition to what they're doing to help the public. I would be remiss and probably hung by my thumbnails when I get back to work if I don't mention the bargain boutique and thrift store. I don't know. For those in the audience, how many have been there? Okay, for those in the television land, lots of them held their hands up. The Bargain Boutique Thrift Store is at 80 East Hillcrest in the Community Conscience Building. It's a phenomenal place to visit. It's a great place to shop, whether you really even want to buy. It's a great place to donate. It's really a very upscale. It provides about 14% of our revenues so that we can provide service. So it is a critical place to go. So give us your goods and come buy them back for you if you want. In addition to that Bargain Boutique works with all the social service agencies in town and specifically in the Community Conscience Building. And we work on a voucher program. So several hundreds, thousands of dollars go out to other social service agencies. So your goods that you're donating there aren't really just helping seniors. They are going to the other agencies in that building. So all of the things we do, take a deep breath, all of the things we do is aimed at making the life of a senior and or their families, and then the community at large, easier, figure out how to become a senior and do that successful aging, just as we're going to talk about next week.
Thank you. The future promises, I didn't ask you enough, I'm going to ask you some more. The future promises to bring an increase in the number of seniors seeking health care services and programs. This increase will come about due to two facts. One, those baby boomers are turning 65 and we are living longer. This will result in having to serve two sets of seniors who will likely be looking for different types of services. The young will be looking different than the older. In addition, we can expect the healthcare industry to find new ways to diagnose and treat many illnesses. Both of these situations will affect the way we do things today. Are you planning any new programs or services to accommodate these anticipated changes?
Senior Concerns has added a new program, not every year, but almost every year. And if they haven't added a program in our 34 years, we have revamped the ones that were there because needs do change. What we want to have happen for ourselves does change. About a year ago, that board of directors I mentioned embarked on looking at strategic planning and said, you know, what's coming out there, what are we doing, what works, what doesn't work, and doing a good assessment of all of those programs. They pretty much assessed the fact that we were doing pretty much all the right things. The day program was critical, cannot be let go. The Meals on Wheels, critical, could not be let go. The day program may need to tweak a little bit, and I tell the staff now that when I'm at the center, because I work there, so I'll make sure there's a place when I need it. When I'm there, I love swing music. I dance to it now. But please, I want Ricky Nelson, Elvis Presley, the Everly Brothers. I don't want, Guy Lombardo and other wonderful people. That's a small example, but we must keep up. So they did look at it. A couple things have come our way that are making it possible to start a couple new programs. One we started this July. And when I hear about the services that are being removed from our seniors, we in the nonprofits, I'll speak for all the nonprofits, are looking at what has happened in that state budget and saying, what is that impact going to be on us? We can't really predict it yet. If I look at senior counseling and the advocates and the care managers, they are going to be hit very hard, because those services are not going to exist like they used to exist through our area agency on aging or through the state programs. And the kind of medical things that were cut from the state program, people are going to be coming into Betty and or our other staff and saying, my toes hanging off here. What I need podiatry. And so we will be hit hard. We started one program which we realized there would be a lot of seniors left alone and without their cares in their home, and working with RSVP, Retired and Senior Volunteer Program over at the Gobo Center, we started a care call program. We started in July. We have several. If there's others out there who might want information, again, call that phone number, 805-497-0189, and let us know you'd be interested. What it is just volunteers who are calling seniors who might be home alone. Maybe families work, or maybe they live alone, and they don't get as many phone calls as they used to. And we all need to be social somewhere. And sometimes you can't get around as much as you used to, but someone will call them every day, once a week, a couple times a week, whatever is necessary, just checking on them and giving them a chance to talk about whatever they want to instead of talking to the cat or the television that doesn't always talk back. So that was one new program. The other one is more aimed at what Betty has mentioned, this wave that we all in the senior world keep waiting for, those baby boomers. Now, if you imagine that our average age of the seniors we provide really is 83 in our day program, about that same age in Meals on Wheels. So our two core programs, it's going to be a few years before those baby boomers hit it, but some of them are going to need it at 60 and 65, not all. We looked at those and said, what program do we need for that? And there's a lot of new technology out there called software programs for brain fitness. Some of you have probably heard about them. We received a grant from Verizon, so within the next month or so, you're going to be seeing an announcement of our new program, and it will be a brain fitness program. Brain fitness requires 4 components, however. There is the computer technology program piece. To be most effective, it must be combined with exercise, socialization, and nutrition. So the program will involve all 4 components. We will be In fact, our computers should arrive this week, and we will be doing some little remodeling around the center to try to get us the right room to use those computers, whereby the public, baby boomers or else, will be allowed to come in and use those computers, use that software program, and attempt to. What science says that we're learning now is that the brain is much more elastic than we thought, perhaps. There's something they refer to as your neuroplasticity. It means your little neurons up there may be just a little more forgiving, or you may have more of them than we used to think. We used to think if you had brain injury, that was it. That's just where you were. But we've learned that we can create new pathways. Now, I know I know a rocket scientist who has very advanced Alzheimer's. How can that be? He was continuing to work. He used his mind all the time. We don't have all the answers, and I don't say this cures Alzheimer's. What we're learning is it may slow the progression of the disease Alzheimer's, and it also, for those of us without that diagnosis, may slow some of that natural aging process that really isn't disease, but still you need to exercise your brain just like other places. So brain fitness is a coming market, and Catherine, I'll tell you first, I think you'll have to watch for some more scams. But
I think so.
Senior Concerns promises not to be a scam. And so those two programs are two very exciting programs that we're going to be starting here in. One has already started, the other one in another month.
Very good. Your third question is, so far today we've been talking about seniors in general. However, there is one type of senior whose health burdens are many times overlooked or may even take a back seat. I'm talking about seniors who are caregivers, especially to other seniors. Would you address the health care problems that senior caregivers are likely to face, and what type of services are available to assist them?
I think I've mentioned a lot of the programs that we have that are aimed at that assistance to try to relieve that burden, if you will, of the caregiver. The kinds of things that can happen, there's just the pure exhaustion that comes with, if you've read the book, this 36-hour day. It was written about Alzheimer's specifically, but it can apply to anyone that you're having to provide total care for in your home or elsewhere, or even have to be thinking about them 36 hours a day. Pure exhaustion, stress, everything from bringing on, if you will, that stroke or that heart attack. The other issue that most face is just the physical strains. The back that gives out, the arms that give out, the falls that give, because that caregiver isn't able to take as good care of themselves as just by what needs to be done out there. We can provide through advocates, through our day program, through our care coordinators, resources that you can figure a way. Some of our respite time has been taken away by the state, but that we can figure a way where you can figure out how you get some help in the home. Maybe you can't afford it all, because it does get very expensive. What are your alternative kind of residential spots? Our goal is to keep everybody as independent as possible in the home, but when the caregiver can no longer, recognizing there are solutions for that call Senior Concerns. If you have a question, call us. The kinds of things that can happen to the caregiver, just imagine yourself being awake for 36 hours and what would happen to your body.
Caregiving is a fact of life, and former First Lady Rosalind Carter put it this way: there are 4 types of people, and you will fall into one of them. Either you were a caregiver, you are a caregiver, or you will be a caregiver, or you will need caregiving. So you're going to fall into one of those, okay? A person who is isolated is not a healthy person, so daycare centers are the place to take these people. They get both nutrition and socialization, and they come out feeling much, much better. Senior concerns doesn't serve just one group of people. Some think that we only take care of the low income. We don't. We have clients from HUD housing all the way through University Village. And my chance to make my brain work every day, and maybe you'd like to try it, is do a Sudoku puzzle every day.
Now, Betty, I have to clarify. If you're a mathematician already, learn a foreign language.
There you go. Okay, welcome, Diane. Diane is here from Los Robles, and as I said in the beginning, she is the Director of Infectious Protection. We're going to ask you some questions about inoculation, shots, etc. Question 1. With all the recent information about the coming flu season, seniors are concerned about which flu shot they should plan to receive. Could you please address the seasonal flu vaccine and the H1n1 vaccine and provide information on the need to have one, both, or none? Also, could you provide information about where and when these vaccines will be available?
Happy to.
Thank you.
Let's start with the seasonal flu vaccine. That's what all of us call the flu shot. The flu shots have been around for a long time, and each year the CDC and the drug manufacturers make a formula based on what they think will be the circulating virus for the flu season. Okay? So that's the seasonal flu shot. These shots are currently available, but there's a lot of misinformation, and a lot of the public is very concerned this year. Everyone wants to get a flu shot, and everyone wants to be protected, and the media isn't giving clear information because it's changing day by day by day. So, some of the manufacturers have halted or reduced their production of seasonal vaccine in order to produce H1n1 vaccine. It does not mean there's a shortage of seasonal vaccine. It is available. It will just be released from the drug manufacturers in waves. So instead of producing all of the vaccine right up front, they're producing a little bit each week so that their facilities can also produce the H1n1 vaccine. Okay, so there is plenty of seasonal flu vaccine available this flu season. All seniors should definitely get their seasonal flu vaccine. It is highly recommended to prevent illness. Flu is a vaccine-preventable illness, so get your flu shot, take the vaccine. Okay? Now, for H1n1, that's the one that has everyone concerned because it is a new virus. It's an animal virus that has now spread to the human population, and it's being spread from human to human. Everyone's concerned about the pandemic, and pandemic simply means it's present in all continents in the world. So it's widespread around the globe, it's in all continents of the world, and there have been humans who are sick with it and humans who have died from it. There are humans who die from seasonal flu as well, so it's no worse at this point in time, and this again changes every day. It's no more virulent, no more costly in terms of human life than the seasonal flu is. Okay, so at the present time, there is circulating virus that is H1n1 that is causing humans to be sick. Should seniors get this H1n1? At the present time, the CDC and the state of California are recommending the H1n1 vaccine for the very young and the middle adult-aged population. It is not recommended at the present time for seniors. Seniors being defined as those greater than age 50. Okay? So children from age 2 through 24 and young adults from 24 through 50 should get the H1n1 vaccine. Okay? It's a little different than the seasonal flu. The seasonal flu will affect the very young from 6 months of age and the very old, our seniors, but the H1n1 hits that middle population. Okay? And presently, the H1n1 is a rather mild virus. People get sick, but there doesn't seem to be a lot of mortality associated with it at the present time. And I have to stress that because it keeps on changing. Okay. There are flu shots available at most pharmacies, at Vons, at CVS. I know that the Public Health Department in Ventura County has sponsored several, one of them at the Simi Town Center, and they're having another one, Los Robles is having another one at the Surgery Center parking lot on November 14th. Okay, that'll be from 10 o'clock till noonish.
Are these free?
These are free shots, yes. The H1n1 vaccine, you all may have seen on TV yesterday that it is available now. And most of those photos that I saw on TV were all in LA County. We have signed up to receive it in Ventura County. I have not yet been notified that they've received it or that they're distributing to us. So I don't yet have information from the state about availability in Ventura County for H1n1. Okay. It's coming through the state. We can't buy it directly from the manufacturer. It's all going to the state, and the state is distributing the H1n1. Okay.
Okay. Second question, we have all kinds of shots.
Yes.
Seniors have also been asking questions about the pneumonia inoculation. Would you please explain who should get this vaccine and how often, and can the pneumonia inoculation be obtained at the flu clinics as well as the doctor's office?
Okay. Pneumonia shots are typically available at your doctor's office. They are recommended for people age 65, and it's a one-shot deal. However, if you are age 40 or older, or even younger, and you have compromised lungs, or you have other immunosuppressive diseases, maybe you have some other chronic illness, lung disease, cystic fibrosis, where getting pneumonia would make you gravely ill, then the shot is recommended for you when you're younger than age 65. So if you get a shot before age 65, you should get one more after age 65, and that's it for life. Okay? There's a misconception that pneumonia shots are needed every 5 years, and that is a misconception.
Okay.
Okay?
That's good to know. Okay, third question, the newest shot, which everybody seems to be talking about. Again, on the subject of inoculations, there's been great interest in the vaccine for prevention of shingles. Who should have this inoculation? Is it a one-time only vaccination? Where can it be obtained? And also, are there any other preventative inoculations that you would recommend for seniors?
Good question. The shingles vaccine is called Zostavax. Shingles is also called herpes zoster, so therefore the vaccine is Zostavax. It is a frozen vaccine, so it's a little more difficult to find a physician's office who carry it, who have it in stock for you. And it's also expensive. It's approximately $300 per shot. Some seniors have very good Part D coverage, and it's covered, and others do not. So physician offices will sometimes ask for payment up front. Now, who should get the vaccine? Anyone who's age 60 and above. I don't know if you've ever had shingles. It is a inflammation of your nerves, and typically it's the nerves that go around from your back towards your front. So you typically will experience pain and discomfort and itching all along the side of your body, and it can last for sometimes for a few months. So it's very uncomfortable, and again, it's a vaccine preventable illness. So it's recommended. Ask your doctor for verification. Should I get it? You know, is the $200 worth a couple of months of uncomfortableness? You know?
Can you get shingles more than once?
You can get shingles more than once, but it's very rare.
So if you've had them, you're fairly safe?
You're fairly
even if
safe.
It was at an early age?
Yes. Yes.
I'm asking because I had shingles. Okay, Okay, I'm going to go to Catherine a minute. Catherine, you and I have run into Medicare billing for shingle shots, and I think you can give us some details on that.
Okay. The shingles vaccination is payable under Medicare. And like Diane said, you're not going to usually get it from your doctor's office. They will give you a prescription for your local pharmacy, and not all pharmacies will carry it. So there's another little thing there. They will give that to you, and then they will build whatever you have on your Part D. Now, we'll talk about Medicare Advantage in a minute. Well, this is strictly Medicare Part D with Medicare. Then you only have about an hour and a half to get it back to the doctor, get the shot, because it's a live vaccine and it has a very short lifespan. So you really need to do good planning when you're doing this, and then your doctor can bill Medicare for the administration of the vaccine. So it will be split. The doctor will bill for the administration. The pharmacy maybe will bill for Part D, or you can actually submit the bill into Part D, but they should bill for it. Now, on the Medicare Advantage side, that's where it gets complicated, because for every HMO or PPO or private fee-for-service plan, every rule could be different for whatever plan you're on. So you really need to check with whatever plan you're on to find out what their rules are and how it is. But they do have to cover it under the Medicare rules and regulations. And if they tell you they do not, then you need to come and see us, because that is your right, and that you should be able to receive it. Now, for those of you, for whatever reason, may not be on Medicare, at the public health, they will give it to you, and it was costing $157. So they may have gone up or down, but the last time I checked, that's what the cost was.
Okay, and as Diane says, it's worthwhile. It's worth the money.
Definitely.
Okay. It's just a little complicated, but you have to plan ahead, and we're back to you have to take the responsibility to do that. Okay, I have one general question for all three panelists. You can take whatever side you want. We all know how important volunteer services are to making programs work. And a recent study showed that those seniors who do volunteer are happier and healthier. Does your organization use volunteer services, and if so, in what capacity? Whoever wants to go first can go first.
Okay, our agency and our HICAP department would not exist if it were not for volunteers, because we are a volunteer program. We're covered under the Older Americans Act. They give the funding down to the Center of Medicare and Medicaid Services. So we are under the auspices of Medicare, who then gives the money down to the State Department of Aging. We report to them, and then we are a county agency on top of it. But I only have a staff of 2. And there is no way we could do the work of what we have to do, because we have 119,000 Medicare beneficiaries. That does not include the Medicare disabled that we take care of also. So we have a big job, but it's fun. We try to have fun with it. We really get the volunteers involved. It's very rewarding, because when you're really helping someone, it makes you feel good. There are times when sometimes you can't help someone and then you don't feel good, but more often than not, we can help them, and you go away with a good feeling that you've really done a good service. But we are not a gentle volunteer program. We work hard. So in the open season, some of our volunteers work 40 hours a month, if not more. And so in that, you're allowed to do as much as you want. You're allowed to take vacations whenever, but you are our backbone, and if it wasn't for volunteers, HICAP would not be here. And so you, on the Council on Aging, who are on our advisory council, we could not do it without you either, because you give us the direction of what we are supposed to do and try to keep us in line to make sure we're doing what we should do out in the communities. So we thank you also. And it would be very helpful if more would step up and do volunteering. because you may not like all of the Medicare and ours, but there's places that you could do office work or whatever in our program, and on the advisory council, there's some really good things happening on your advisory council.
Thank you,
Thank
Kathy.
you.
I will say that the high-cap counselors are probably the best trained volunteers in the county. They go through extensive training to begin with. It's about 10 weeks. And then they go out and work with another counselor for at least 10 weeks. And then they're given their assignment. And then every other month, Kathy calls us all back to train us on something new. So they really know what they're talking about, and they are a dedicated group. Okay. Whoever. Diane?
At Los Robles,
Yes.
we could hardly exist without our volunteers. They do everything. They take care of the patients, they feed patients, they discharge patients, they rock the newborns, they assist with paperwork, they collate packages. They do just about everything. They run little errands, they deliver the flowers. I mean, they are the glue that keeps all of the departments moving and flowing, and nothing is too large or too small. They're always willing, they're happy. You know, I can't speak highly enough of our volunteers. They have a great leader named Irene. She's just wonderful. So, yeah, we absolutely need our volunteers.
Working with RSVP, we keep track of which agencies have the most volunteers, and Los Robles comes up very close to the top some years, on top some years. They vie for that with the docents at the Ronald Reagan Library. Okay, Carol.
She said that as a docent from the Ronald Reagan Library. I think there's another thing that volunteers do, and having spent part of my life at Los Robles and other hospitals, no matter how much a nurse and or hospital staff person cares about what they're doing for you, they're being paid to do that. And they're kind and they're great. The volunteer is doing what they're doing because it's coming from the heart, and you just feel better getting it as well as they do. So they're wonderful. But senior concerns, like these two ladies, we wouldn't exist. Meals wouldn't go out. Dancing wouldn't occur. Singing wouldn't happen. All of our entertainment at the day program is provided by volunteers. We don't pay for any of that. If we had to, we wouldn't probably exist. So we have about 921 people who give of their time in some fashion. I have lots of things that anybody, if you've got an hour, I have something you can do. The Bargain Boutique exists because of volunteers. It's a volunteer-run shop. There's only a couple paid staff people there. For every 3 hours of paid staff, I have 1 hour of volunteer time. Imagine having to pay for that other 1 hour of volunteer time. It's a pretty phenomenal workforce that comes, and it's not just these three folks sitting here throughout our community. There's lots of places. So I highly recommend RSVP. They'll find a spot for you to give of your time, and you will feel better.
Thank you. It is known that volunteers are healthier and happier. There are many places where you can be used. We would like to see more of you volunteer. Now, did you get a wealth of information today? Okay. I now have time. If any of you have questions for the panelists, I'd be glad to take them. Yes, Jim.
Well, just a couple of simplistic things. Kathy, this re-enrollment period of time, if you have no intention of changing, I'm a Kaiser guy, are there steps I still must take?
I'm going to ask you two questions. Are you a retiree or just on the senior advantage?
I'm a retiree.
Okay. You probably should do nothing, because you
I'm
probably have the
extremely
best.
good at that.
But now, see, we have to ask that question, because if you weren't, and I said do nothing, then you could be in trouble. So we always go and ask, are you a retiree? Do you have other employer group insurance or what have you?
Yeah.
But no, you don't need to do anything to stay right. But you should read what your evidence of coverage states, so you know what you're going to be doing for the new plan year.
Okay. And what are the really quick, the shingle thing, is that a one-time only thing? Okay, thank you.
Yes, it is.
Any other questions? Oh, come. Yes.
Hi. I had a question primarily to Carol. You talked about the software program for brain fitness. Is that an available program? I'm thinking of the Global Senior Adult Center. I'm on the commission there, as you know. And we have 9 computers that are available, and I'm wondering if that software program might be used for the seniors that visit our center.
There are several kinds of software programs out there. The one that Senior Concerns will be implementing is dedicated to our site and licensed to our site, so is only permitted to be used in our programs. We will launch it in our site first. We are looking at whether it is movable. It is movable, I should say. We are looking at whether we can take it to other centers or if we should expand our program, just opening other centers up after we get the one started. There are 2 kinds. This particular one is an internet-based program. So and it is a licensed particular system that we have to acquire. There are other programs that are CDs that you can acquire that you buy for yourself and you can take home, and certainly that would be something that the Global could look at doing as part of the council and having some programs there. All of the programs work better if they are done in a structured setting, having a software coach with you so that you not just coaching you on how to use it, but on the kinds of things that you're going through. So it's a program that we would look at expanding. Our initial program will be strictly at Senior Concerns. But you're welcome to come there. I'll clarify. It won't be intended just for the participants in our day program. It is open to the public. It's a new program that will bring 55-year-olds, if you will, into the Senior Concern setting to use, on an appointment basis, to use the program.
Thank you. We do have a program at the center that's a regular program. It's a hands-on and a regular program. But I was just wondering, that kind of software would be readily available for a greater number of people. Get some kind of group license or something of that sort.
And that's what we have acquired now for ourselves, is that license to handle numbers of people, and hopefully we'll be so successful that, yes, we can create other sites and or increase our capacity.
Thank you.
Nick?
Carol, when you were talking about the negative effects of the caregiver's experience, one that I don't remember hearing you talk about was guilt, and it strikes me that most caregiving arrangements are relatives taking care of relatives, and there's often a strong factor of guilt associated with that. Could you mention how you think that weighs in with other negative effects?
No, well, I should have mentioned it. It is probably the main resentment, guilt, wishing you could escape. All of those things are present, and that's why support groups, whether you're dealing with an individual, you're a caregiver for Parkinson's has support groups. If the support group component is what makes it possible to deal with that guilt and say, okay, I'm not such a terrible person. Everybody feels guilt.
Mel?
Thank you, Betty. You have mentioned throughout the program, I guess all 3, maybe the first 2, you have mentioned the use of the Internet and getting information on the Internet, and you can be sure that that's the wave of the future. But it seems to me, and it seems to us, I think, in some of our studies in the Senior Master Plan, looking ahead, those that need services most, the frail, etc., probably are also those who have least access to. I think that's a generalization, but I suspect it's probably good. Do you have any suggestions how we might get through this transition? Because it's going to be a long transition. We're living older, on the older side. We're trying to deal with that here as part of our vision of the future. Any ideas on that?
I worked on that a little bit with you, and I saw the other day that 85% of individuals 55 years of age, 55 years of age, did access the internet. 85% at 55 years of age. At 65 and above, it drops down to the 60 percentile. I think then you do have to bring in the economic factor and other things, that, just how one lived their life, what exposure, what experiences did you have from a work setting versus, maybe the widow who never worked outside the home, who's now at home and is less likely, from things I read, having access to internet. Andrea's over here. The Go Book could do a lot for that in introducing it, and I know they have the classes, and I would encourage people to take that internet class. Just how do I use my web? Because you could always take Dollaride and get down to the Go and access the web. That's one good way. We at Senior Concerns still do utilize print media. The radio, I know. The radio, we don't really have access for television a whole lot. That's a local TV, but certainly this is an opportunity here. So I think for the time being, our public education, come on site, print media will have to suffice. But I'd like to see, maybe as we look at it with your strategic planning, you look at how do you get the rest of the people access to internet.
Thank you. I should mention that since Carol is a very strong participant in our Senior Master Plan program, has been and will continue to be, that might be something to think about under access.
And I also think that even the baby boomers, as they age, they're not going to have the access because they may be on low income to where they can't afford internet unless it becomes cheaper, because you're going to have a lot of baby boomers that have not planned for the future. You may think they have, but they have not. And we've done, not we, but our industry has done some studies on that. So as they become older, and with what we've been going through in this economic crisis, I keep hearing of people in their 50s and their 60s that have lost all of their 401s and different things like that, or their stocks and what have you. So I don't see it just in our seniors. I even see it coming up the ranks.
It's been said that the group coming up is not as well taken care of as the group that is here now. So yes, we have a lot of trouble ahead of us. Yes.
Carol, probably for you, do you, even if someone could, is it not on? It's my voice. Do you know of any kind of a program where somebody who could maybe go to GoBull and pick up the necessary skills and maybe get through some of the cheaper things that combine your phone service and your computer access? Do you know of any programs where people could get computers that were maybe used and then people move on from their computers very, very fast, and there are a lot of them that would still be very workable. I wonder if there's any kind of a program for that.
None that I know offhand. I'll look over at my knower of all things, Betty. But there are programs for nonprofits to acquire computers and computer programs at substantially reduced rates. So perhaps that's something else, particularly if it's just a computer that all you wanted. You don't want to do Excel spreadsheets and you're not doing any complex programs. All you want to do is internet access and email, because you want to talk to your grandchildren. It's the only way they're going to talk to you. But I'll look into that. I don't know of one, but maybe that's next year's new program.
Yes.
I find that the quarterly statements that Medicare puts out to be terribly complex, busy, and unreadable. Since I'm a TRICARE for Life recipient, then I have rolling receipts that come in, and matching the provider with the service provided in anywhere near real time is almost impossible to do. If anybody has a thought with any kind of an in for government, I'd like to see it go back the other way.
Well, actually, I sit on a national policy for Center of Medicare and Medicaid Services to change in policy and to maybe even introduce new policies. And that is one of the things that we are looking at. But what you can do, and it may help you if you join that mymedicare.gov, you can go in there and ask for just a summary notice, and they will send it to you.
Yes.
And so you don't have to wait quarterly, and that might help you in some ways. But some of us in HICAP are very good at doing that, so if you need some help, we're more than able to match up for you.
That also, the problem is that if at our age you have any kind of a fairly complex procedure, a colonoscopy, it doesn't seem complex, but it is, because there are a lot of people that are involved. What happens is now my paper file at this juncture of the year for just the routine things that my wife and I do is now this thick. It always has been roughly this thick, but I've got to look at least in two different places, and then I always have to be careful as to who is the primary and who is the beneficiary in this particular case. In my view, for whatever it's worth, it's unnecessarily complicated, and I ran into a situation where I needed to, for some reason or other, somebody said you haven't paid your bills. So I had to audit those files going back 2 years 3 times. Very, very, very difficult to do. So I'd argue, please take a look at it.
Well, we do auditing for you. That is one of the HICAP things that we do. It does take some time, and we would rather not do it right now, but we do, because it is very intense. But we have had sacks thrown on our table and had to go through and do that. But we do that. We'd be more than happy to do it for you or anyone else.
And we've developed a spreadsheet.
Yes,
to
we
do
have.
that with. You get stacks on your table. One day a lady came in and said, I can't understand these things. I said, bring them in to me, and she brought a shopping bag full.
Mm-hmm. And believe it or not, on mine, there was a couple of checks in there, too.
Yeah. Are there any other questions? Any from the floor? Yes, ma'am.
I'd like to know what Medicare Advantage is. I have the primary, which is Blue Cross and Medicare, and I don't know, I never heard Advantage before. So.
Medicare Advantage is the new name that came from the Medicare Modernization Act of 2006. Before, it was called Part C, and it was really only HMOs. But with the Medicare Modernization Act of 2006, now it is called Medicare Advantage because there's more than one entity. There's the Medicare HMOs, there's PPOs, there's private fee-for-service plans, there is a Medicare savings plan, and then there is some special needs plans. And so they gave it a name to house everything in there, and all of these plans are administered through an HMO company, parent company usually. Now you're saying you have Medicare and Blue Cross. PPO, and this is on Medicare. Okay, your PPO is your primary? Okay. And it would be if it's the Medicare PPO. Is it the Freedom Blue? Yes. And it's not from a retiree or anything like that? No. Yes, then it is primary. And essentially, you've given your Medicare up, and Medicare pays that PPO X amount of dollars a month to take care of your needs. So you're following the PPO's rules and regulations, but they in return have to follow Medicare rules and regulations. And you do have a good plan. The PPO is a good plan, and I do know that they're probably coming out with 3 plans for 2010. So you're going to get a lot of literature on that from your Blue Cross, from Anthem, and you might want to take a look to see which one may suit you.
Yeah, because before it was called Freedom Blue.
Yes.
But now it's called
Anthem.
Well, Anthem is the parent name across the United States. And then the Freedom Blue means it's PPO. And then I forget what they're called now, the three, because I just looked at them yesterday. It's like, but they've got three different names. It's Freedom Blue, I don't know, plus Freedom Blue Gold or something. But that's what it is. So you will have additional PPOs for the coming year.
Did you say the number of questions that Kathy had to ask for that simple question? That's why our appointments take so long. Yes, ma'am.
I'm discouraged. I have a lot of information coming in where these kids, I know the seniors are well taken care of, but these kids are baby boomers have lost their job, lost their health insurance, and they don't know where to turn. Is there an agency that they can go to? These are professional people that cannot get jobs.
Actually, we at HiCap, if they call us, we take care of them and we'll counsel them to what we know of different programs out there, because I make sure we stay abreast of the programs that they may be able to tap into through nonprofits, through the Ventura County healthcare system or whatever. So we do take care of them. If they call us, we give them an appointment and we will try to help them to the best that we can.
People I know of that have applied, and they've been told this is for low-income people, they are privileged with their...
I would tell you that there's called an ACE program through the county, but right now they haven't reopened it because they're at full capacity. But it does take care of anybody that is not 65. That's not true. That's not true. It is not true. Well, they can come to us and we can see what we can do. I will not promise that we can do anything, but we will give them all of our knowledge and experience out there. It's we see it all the time. Yes. It's very hard.
We do serve those under 65. Problem is, many of our programs are geared to 65 and over, but where there is some place to send them, we will send them.
We've even been known to help ones that have insurance problems that aren't on Medicare. Right. Don't want to do a lot of advertising on it because we really are for the seniors, but we never turn anyone away. 1-800-434-0222. You're welcome.
I think we have a question right here.
Very briefly, could you clarify the age and the amount of shots between pneumonia shots and the shingles? I think I got them confused. I obviously need the brain fitness program.
The pneumonia vaccine is a single shot, and the Zostavax, the shingles vaccine, is a single shot, but they're separate from each other. Okay. Age. Over 60 and above for the Zostavax for the shingles. Pneumonia, one shot after age 65. Okay? You're welcome.
If you have a disease that may affect your lungs, even diabetes or other related chronic diseases, then you can get the shot before 65.
The pneumonia shot.
Yes, the pneumonia shot.
Okay. I will be on Medicare in July 2011. And since the enrollment is in November, should I just do the least expensive Part D and wait until the enrollment to know what I'm going to do, or what do you suggest?
When I turn 60. When I turn 64, what do I do? Well, first of all, 3 months prior to your 65th birthday, you're going to call Social Security to sign up for your Medicare card, A and B.
I'm already taking Social Security.
You already have it. Okay.
So I don't have to call.
Are you on Medicare already?
No, because
okay. No, when you're able to get your Medicare, whatever that date is, then you need to make a HiCap appointment and come in, and we will help you go through all the process of picking your plans out, picking your prescription Part D plan, and it will work until the December 31st. But then you would come back in November and we would do for the new year.
Okay, and Medicare due comes on your birthday, right?
It will. You will start Medicare on the first day of the month of your birthday.
Okay, thank you.
You're welcome.
I have another question. You mentioned a fee of $300. Was that for Medicare?
That was a shingles.
That was for prescription Part D. The new deductible is $310, but some plans will have no deductible.
Okay.
Some will have a partial deductible, or they could have a $310. So that's the deductible for the Medicare Part D.
I would suggest that if everyone attend one of the seminars about Medicare changes for 2010, and especially for the Medicare Part D. We will have forms there. We will answer questions. We can point them out, and it will go on that way.
And that's in November, right?
Yeah, we will be around in November. In Thousand Oaks, it will probably be every Friday in November. Okay? Well, I want to thank all of you here and those on television for attending today. And before I close, I'd like to thank the members of the panel for taking time out of their very busy schedules and sharing their expertise with us today.
Amen.
Thank you.
And we thank you.
Jim, I give it back to you.
Thank you so much, Betty. This has been an inspiring program. Thank you very, very much. And thank you, folks, for being here. We're now moving on to the rest of our business portion of the Council on Aging meeting, and we're running a little short of time, so we may just kind of race through some of this. The next item on our agenda is a report on fraud. We're going to move that over to our November meeting. Programs is the next item on the agenda, and I would wish to suggest to you might be interested in watching our next meeting. We're going to do a recap of what we all experienced at the Senior Summit, which will be mentioned in a moment. We'll skip on down to item D, the master plan. If you could give us a brief overview of our recent Sampic breakfast, Mel.
Thank you very much. I'll do that and add another thing. October's a big month for the City of Thousand Oaks Senior Adult Master Plan and the future of the senior community. The two big milestones will take place this month. One has already taken place. The master plan will be, which we refer to as SAMP, will be presented to the City Council next Tuesday, October 13th at City Hall, shortly after 6 p.m. So come on down. If you can't be there, tune in on TOTV, Channel 10, at 6 p.m. Find out what's going on. A lot of things we spoke about today can be factored into the master plan. The second milestone has already occurred. It occurred yesterday. We started to form a volunteer team to implement the recommendations in the master plan, officially referred to as the SAMP Implementation Committee. Dedicated volunteers have taken us this far, and volunteers will lead the way to the future. But there's still time to get involved in a leadership opportunity to shape the future of our senior community. The train hasn't left the station yet. Get on board now for a wonderful ride into your future. We need your skills and community passion. And hey, you boomers out there, yes, we need you too. You are a key part of your own future. You can get with the program now. Surely you have some time to help build a better city. We'll even accommodate your busy schedule. How can seniors and boomers get on board for this exciting journey? Just call 449-2743 or email councilonaging@toaks.org, and in the subject space, just write SAMP. Thank you.
Yes, thank you, Mel. Martin, would you give us our liaison reports, please?
Okay, the first one would be on Ventura County AAA. Do we have a report from that one?
Yes, thank you, Martin. We are focusing now, and Jim mentioned the Senior Summit. Ventura County Senior Summit will be on Saturday, October 24th at Cal State Channel Islands between 9 a.m. and 2:30 p.m. Wonderful sessions, a lot of discussions that were held today. A lot of that information will come up. How do we deal with senior issues in a changing economy or in the current economy? lots of opportunities to get involved, lots of opportunities to get involved in advocacy. In order to, I'll just very quickly, you'll get more information, and you can register at 805-373-2564, or if you're on the internet, www.ventura.org/Senior Summit. I should mention that transportation will be available from senior centers, and if Andrea has some more information on that, she can, thank you. And will be because parking could be difficult there. There also will be complimentary lunch. So if you want to get involved in senior issues, and if you want to know what's going on and want to also get more information like you heard today, please attend this session. Thank you.
Thanks, Mel. Retired Senior Volunteer Program just wants to remind its volunteers. The RSVP would like to remind its volunteers to please turn in your September timesheets. They need them before they can prepare their annual report. Our next item on the agenda would be the Global Adult Senior Center. Andrea, I'm sure you have many good things to tell us.
Well, first of all, I kind of just want to say hi to everybody. I'm going to give the phone number to the Global Senior Adult Center at the beginning here, and I'll do it at the very end, and that way anything in between, since I know I have to talk fast, people can call the center. So the Global Senior Adult Center is 805-381-2744. I do want to kind of back up on some things that were being said by Catherine and Maureen. So I got our flu shots. We are actually doing flu shots. They're coming up very quickly here. They're going to be October 17th from 9 a.m. to 3 p.m. And it's just the general yearly flu shot. So all you need to do is show up. No reservations, no nothing. Ours aren't completely free. If it's Medicare Part B only that you have, then it will be free. They will be accepting Medicare only. Other than that, it would be $30. And they'll serve everybody. And pneumonia shots are also available if you do need them there. So if you need an update or you've never had one and you're now 65 or older, you can get your pneumonia shot there as well. So again, that'll be October 17th, that Saturday from 9 to 3. We just finished up a USO event, which was really cool, by Moving Seniors Forward Incorporated. It's a network group. They did a really great job at the center this past weekend. We had 168 people, not including volunteers and performers and the network group. So it was very good. Professors and Pastries, it's our fun program through Channel Islands University and the Osher Institute. So they provide professors on the first and third Wednesdays of each month, and it's free, and we provide the pastries, and the professors talk about a whole variety of things, and we have flyers. I'll even leave some behind. You can also call the center to see what's coming up, and all we do is take name and phone number. That way we make sure we have enough seating for the program. October 16th, which is a Friday, the Braille Institute that's at the center is doing a low vision fair, so you can learn about emerging treatments, and diabetic retinopathy. I have a hard time saying that one. There's raffle prizes. They always have a variety of all the different types of aids to help you with seeing, whether it's computers, things for your phone, handheld things for reading. So it is a really good program to come out, and that's free, and that's from 10 a.m. to noon. Solutions for Seniors. That's Tuesday, October 20th. It's a panel discussion group. It's worth your while to come down and get all that good information on it, because they'll talk about long-term care, they talk about Social Security, they'll talk about housing, they'll talk about insurance. So it's kind of like a catch-all, and then where you can go to get all your different referrals, and a light dinner is included in that, and it usually fills up, so you definitely need to call the center and get your name on the list for that. Table tennis tournament. This is always fun. It's going to be Wednesday, October 21st. There's still time if you do play table tennis and want to get in on that. It's 50 plus, broken down to age groups, male, female, singles, doubles. So it's a good event, and you'll also get a light breakfast. Well, you'll get Danish and coffee out of the deal, at least in the morning, and then you get lunch. And there are awards, so if you want to do that, it's $18, so that covers the awards, the breakfast, the lunch, and good fun. We also have our Singles Unlimited. They're doing an All Hallows Eve, singles only, costumes not required, but welcome. So that'll be Thursday, October 22nd from 6 to 7:30 p.m. And they're also going to have somebody come and talk about brain and body into balance so your life is in equilibrium. You can call us at the center, or you can also call Ann Johnson, who's also the coordinator for the program. And her number is 552-6476. And as you were talking earlier, Mel, was about the Senior Summit. So we do have all the flyers on Senior Summit at the Global Senior Adult Center. And again, their number, if you just want to call and register, is 373-2564. And if you're a good techie and like to get on your computer, it'd be www.ventura.org/Senior Summit. Again, the whole program's free, and if you need a ride, whether you're on the internet, there's a box to check, and whether you call them, they will ask you. So they will prompt you to make sure if you need a bus, and there will be one leaving from most of the centers, and there is one leaving from our center. So they're taking care of that, so you definitely need to call them directly. So anyway, that is about it for me, except, RSVP, boutique. This is one way it raises money. It definitely goes to things that are very, very worthwhile. It's from 9 to 3. They're doing a whole holiday sale. We have got so many neat handmade things and things that are donated. It's really great. So that'll be November 2nd through November 6th, so in about 3 weeks. If you want to do some shopping, come early, because they've got good stuff, and it helps support a lot of programs. And if you want to volunteer, we have over 1,200 volunteers, and that's why most of our things and programs and classes are free, because it is volunteer-based. Any questions?
Thank you. Thank you, Andrea. Now we move on to our commissioner comments. I have one, and that is, we're really running out of time here, but I urge everyone to listen, to watch a program on Channel 25 Time Warner. It's called Eye on Issues, and this particular month of October will be on senior issues. And we had a very distinguished panel that was part of this particular program. We had Victoria Jump from the VC AAA, and we had our own Dave Grimm, Commissioner Dave Grimm from the Council on Aging, and Andrea Koval from the Global Center. It's worth watching, 6 o'clock every Thursday evening through October. Any other commissioner comments?
Yes, just a quick comment. We've always been urged to talk about personal things. I just wanted to mention that our chairman, Jim Sheridan, that you heard just from just a moment ago, he will be the lead in Arthur Miller's Death of a Salesman at Pierce College. The dates of presentation are between October 23rd and November 1st, 2009. This is, you do not want to miss this. Please call 818-719-6488 for tickets. Thank you.
Thank you, Gene. Yes, Dave.
I thought Pierce College was primarily an agricultural school. They got something to do with arts? All right, well, that's not the reason for my comment. I wanted to bring up something else that's on the web. Something different, huh? Recently, the city of TO has upgraded some of their pages, and one specifically was on the Thousand Oaks Transit. It's a lot more friendlier. Yeah, a lot more friendlier. Nowadays, use a lot of graphic interfaces, so it's a lot easier to be able to go through the different options that they have, whether it's the routes or the fares, or being able to work with other regional transportation groups. So I encourage you to look at the overall Thousand Oaks website, but in specific the transit website, which is really very really friendly now. Thank you, Jim.
Mel. If there are no other comments or statements, I declare this meeting adjourned. Thank you very much.